We're back on Steel and Bands, and we were so busy in the commercial break going, this is what we should talk about next. I've got so many questions. And Linda goes, no, I'm not done with masks yet.
I'm not finished yet. Dr. Bonnie Henry is the BC's Provincial Health Officer. Very quickly, COVID is airborne, right?
Yeah, it's spread through the air.
Okay.
So technically, there's terms that we use in the healthcare system about what we mean by airborne, and I think it's semantics. It's spread through the air. You breathe it in. That's how you get it most commonly.
Right.
And there's a whole variety of sizes of droplets, and you know, the most relevant thing outside of a healthcare setting, where we do things that make people, you know, expel little droplets of air that are more easily inhalable, is that, yeah, you need to protect yourself from getting those droplets in your nose and your mouth.
So then if COVID is airborne, what are we doing in public places like classrooms or like the shopping mall? Is that a concern?
It is and it isn't, because it's about the volume of air and the number of people and your HVAC system. So we've been working very closely with the Ministry of Education, as you know, so every single school has had an assessment of the ventilation, and there's filters been put in, there's ways to improve the ventilation that they've been working on in every school in this province. So yes, we're paying attention to ventilation. But you know, I mean, this is one thing that happened the other day. I was at the airport in Victoria, which is a very large building, large volume of air, and I was sitting by myself having my morning coffee, nobody around, and somebody came up to me with a mask on and said, you know, aren't we supposed to be wearing masks in indoor places? And I said, yes, absolutely, if you feel like you need that extra protection. But you know, I'm here by myself, lots of air, lots of space. And then later, when we got on the plane, if we were stuck on the tarmac for an hour because they delayed the takeoff time, and we're all crowded in, the ventilation's not good, I put my mask on.
Right.
That's what we need to think about. You know, what are the situations where it's important to wear a mask?
Use
and
critical thinking.
Where is it okay right now? I'm feeling well, I'm healthy. You know, these are the things we need to think about every day. Is it okay for me to go to school? Where am I going? Who am I going to be with? Am I going to go to a long-term care home? If I'm feeling a little bit off, postpone that visit if I can. If I can't postpone that visit, then make sure I'm taking extra precautions, cleaning my hands, wearing a mask, making sure that I minimize the amount of time I'm around somebody who's vulnerable, that they have a mask on if they can. So we need to tailor the things that we know now to the situation we're in.
Right.
So that's the barrier protection with the mask, wash your hands, stay home if at all feeling unwell, and know who you're going to be mixing with in terms of vulnerable people. All great lessons that you've taught us. And one of our actually good friends, who's one of the sponsors of our show, Sharon, Twist Fashions, who has a mask mandate in her store because it is a very small space.
And different people come in, she doesn't know
Small
how well
staff.
they're,
Exactly.
and staff may be feeling vulnerable. That there's a lot of people, that I know quite a few people who have that. And that's, I think that's perfectly fine. And we as customers should respect that. And we have options. If we don't want to wear a mask, then we can phone ahead, we can ask them about things, we can come back another time, we can get curbside delivery. We also now know a whole lot of ways that we can interact and shop and do other things without having to be there in person.
Did you ever get COVID?
Not yet that I'm aware of.
Okay. Well, so
You and
here's
me
my
both.
question to you.
That we're aware
Given
of.
that we have learned a lot about this virus over the last 3 years, if you had a do-over, what would you have done differently as a health officer? Was there a moment where you thought, yeah, I wouldn't have done that?
You know, there's lots of things I wish were different. I think a lot of the times my concerns are that I wasn't able to communicate the differences and the changes and the whys we were changing. So I think there's a number of different things that came up. You know, I was talking about not putting in place vaccine cards, for example, when we still hadn't had enough vaccine that everybody had an opportunity to be vaccinated. But that got translated into, you know, oh, no vaccine cards. But then, you know, we got to the point where we provided incentives, we had lots of vaccine, everybody had opportunities, and we still didn't have the immunization rates at the place where we needed them. And so we very thoughtfully put in place the vaccine card in those discretionary settings that were higher risk. So it was two things, right?
Yeah.
If you wanted to go to a bar or nightclub where people don't wear masks and
dance on the
and
dance floor,
dancing,
yelling at one another face to face.
And then we needed you to be vaccinated because that was a higher risk setting. And those aren't essential for life and death, right? And it protects the people who work in that environment as well. So that was one thing. And the other, I think, really the change that came when Omicron hit, because the tools that we were using quite effectively, vaccination, contact tracing, being able to, limit gatherings and where people were going, all of a sudden those tools didn't work anymore because Omicron was spreading differently. And it was a much shorter period of time between when people were exposed and getting sick, and it was much more transmissible because it was able to bind to the receptors in the back of the nose, so instead of having to go deep in. And so the things like contact tracing were just not possible. So, but it was not easy to talk to people because we'd spent a year and a half saying, do this, do this, do this, and all of a sudden it's like
that. Let's do that now. But you were building the spaceship while flying it.
Yeah.
Like that
exactly.
stays.
So talking about it was different. And also we were in a different place in terms of so many people had at least some protection from vaccination. And particularly those people who were most at risk, and our seniors, our elders, people with underlying illnesses, and they had very high rates of protection. So that gave us a balance, and we're now in a very complex immune environment because we have 85–90% of the population has had at least 2 doses of vaccine, and many people have had an infection on top of that with Omicron in the last year. We've seen that our seroprevalence, so that marker of infection and vaccination, has gone up quite a lot, especially in kids. Most of it over the summer, I will add, when people are not in school.
Not in school, when you're hanging out having the play date at your house.
Exactly, it's not about transmission in schools. But anyway, so we now have a lot of immunity in our community, so we don't need to take as many of those drastic measures. We also know that the societal disruption from closing schools, from not having sports teams and music and art and all of those things that we missed over that period of time, also has impacts on people's wellness and mental health, and it's really important to get back to doing those things.
Can I sneak in one more quick one just about Paxlovid, because that's something that everybody's talking about, accessing that antiviral. That is that something that is incoming in British Columbia in terms of accessibility?
Yeah, so we actually have a fairly accessible. So there was there's a central number you can call, and I don't have it memorized off the top of my head.
We'll make sure we put it out there.
Yes, on the Get Vaccinated websites, and there's a form that you can go through. The challenge with Paxlovid, when it first came out, there was very limited amounts. So we did have a centralized place where people could get access to it, and your rapid antigen tests, if you're positive, you can use those to access it. It's but it has a lot of drug-drug interactions, we call them. So if you're on certain medications, you can't take Paxlovid, or if you have certain conditions with the liver or the kidneys. So you need to have an assessment by your physician, and we have people on the pharmacists and physicians on the telehealth line that can help you work through that.
Good, thank you.
BC Provincial Health Officer Dr. Bonnie Henry, we actually need another hour.
We do. I was going to ask her if she's going to take some time off. Do you get a vacation? It's one of those. Like, let's hope so.
Thank you so much.
So many people were sending their well wishes to you and wanting us to deliver their gratitude. So please do accept that on behalf of the Steel and Vance viewer.
Thank you so much.
Yeah, we
appreciate
your
it.
time.
Happy holidays. Still ahead on Steel and Vance. Who's behind this attack on the Coastal GasLink drill site in northern BC? This happened 10 months ago. They still don't know who's behind it. Now a big reward is hoping to flush out some new tips.